Folic acid is supposed to be taken 3 months before you conceive. That is the ideal time for the ultimate planned kid. Things like hydrocephalus, spina bifida, heart defects, cleft lip and cleft palate have been attributed to the deficiency in folic acid. Why? Are you trying to get pregnant? I know you'll eventually get pregnant. This is the ultimate planned kid experience. Have you heard about folic acid? When are you taking your folic acid? Let me tell you something about folic acid that most people do not actually know. Folic acid is supposed to be taken 3 months before you conceive. That is the ideal time for the ultimate planned kid. Why I'm telling you this? Folic acid helps in the formation of vital organs, which is in the spine and brain development. It helps in formation of DNA and formation of cells. This is why it's very important. By the time you discover you are pregnant, that is at about 4 weeks or a month later, basically when you have officially missed your period and you're like, begin Googling symptoms like how to know you're pregnant, what missing your period means. That's the first symptom of pregnancy. So by the time this time comes, that's 4 weeks after fertilization, the baseline for the spine and the brain development has already formed. Basically, already formed a foundation. And so chances of deficiencies or defects begin occurring in the child if there has been a deficiency. Some of these things like hydrocephalus, spina bifida, heart defects, cleft lip and cleft palate have been attributed to the deficiency in folic acid. Why? Sometimes it is generally deficient based off of the person's diet, but also number 2, the supplements are not sufficient. It is important for you to start stocking up your stores early inside you as a woman by taking folic acid 3 months before you conceive. Of course, it's for people who have planned the pregnancy and are trying to get pregnant. Starting it up early, 3 months before, helps to ensure that the stocks and the stores have been made perfect so that the baby finds enough ground, and by the time the baby is there's enough to form. Because remember, most times they'll begin supplementing it for you when you have officially been discovered pregnant, and it is the first thing of antenatal, which is also a good thing. But the better thing is that you are started earlier before you get pregnant. So therefore, if you're trying to get pregnant, kindly go and get yourself folic acid. Now, for women who are not pregnant, not trying to get pregnant, generally for your health and well-being, because it is used in the formation of the cells and formation of very vital organs and the DNA as well, it is important that you take foods that have been rich in folic acid, like green leafy vegetables, legumes, or foods or cereals that have been fortified with folic acid. These ensure that you have a perfect stores and you're able to form these properly, and really generally you are in good health. So that is the ultimate planned kid experience for today. There are other things that then follow from there. Regular antenatal care, you go and have a doctor that you are attached to and you discuss with, proper hospital visits. These are the things that are going to ensure that we start creating better families. Otherwise, if you have any other questions, let me know. Tell me if you also knew about the 3 months before, because I know most people do not know about it. Tell me about it, and then let me know in the comments what you think and any other questions that you would have for me. Otherwise, that is it for today. Class dismissed.